In this year alone, the American Cancer Association predicts that almost 2 million people will be diagnosed with cancer. Almost 2 million people. And I feel that not enough is said on the topic of cancer and trauma in general, and not enough is said certainly on the topic of the impact of receiving a cancer diagnosis on patients' mental and emotional state, on their state of mind, right? Maybe because there's no point trying to prepare ahead of time for such a defining moment where your whole world turns upside down. Maybe that's one reason, right? How can you prepare for that kind of a moment when you first hear those three powerful words, you have cancer? Maybe there's no point from that perspective. Maybe we can't really, at least not ahead of time, fully understand what these words really mean for us and for our lives, for our loved ones. But we can agree that receiving a cancer diagnosis is one of the hardest things that we'll ever have to experience, and we need to be somewhat prepared. We can perhaps anticipate to some extent what medical treatment looks like because we've been to a doctor's office before, but there's really little that we can do to understand the mental and emotional toll that is part of treatment, that comes along with treatment. And no matter how you want to call this impact of going through treatment, of facing a cancer diagnosis, call it trauma, call it the onset of post-traumatic stress disorder, what we can hope for is the day after, right? The aftermath, the moment when treatment is behind us. And hopefully we can deal with all that has changed in our lives, all that has changed within ourselves. I've been doing this kind of work for 22 years now. And if you talk to patients as I've done, you'll hear that one of the hardest things for them to do when treatment has ended is to integrate back into their daily life, to define their new normal, not knowing if this trauma of going through treatment, the trauma of cancer, will ever truly heal. That's one of the hardest things they have to face. And maybe that's where you are right now. Maybe that's exactly how you feel at this moment in time. Dealing with illness such as cancer is a lot more demanding than many other illnesses. So many moving parts, so much uncertainty, and there's no one size fits all, not when it comes to treatment, not when it comes to outcome, because we're all so very different at the end of the day, right? Different biology, different medical history, unique life experiences that make us who we are. And what all that means is that when we are trying to answer the question of whether or not the trauma of cancer will truly heal, the answer is that it depends to a great extent on what you as a patient are willing to do. And I'm saying this because even though this very moment may feel dark and difficult, you're not helpless and you're not hopeless. Your medical team's job is to do everything in their power to heal your physical body, but your job and your responsibility, I should say, is to do your part. And by that, I mean work to heal the person within this physical body. Work to heal yourself. Work to get your mind on board with treatment and with recovery. And as a cancer and trauma recovery coach, that's what I help my clients do every single day. I help them address the root cause of their traumas and the root cause of their suffering. I help them resolve them, mainly through a methodology that utilizes hypnotherapy or hypnosis. And I'll say more about why we need to use hypnosis in this context of cancer treatment. But if you're raising your eyebrows because your notion of what hypnosis is based on some Hollywood movies that you've seen, or maybe some show you've seen back in high school where your friends were made fun of, it's really time for you to change that notion and understand that hypnosis has been accepted by the American Psychiatric Association in 1958 as a valid medical intervention. And when hypnosis is used in the context of cancer treatment, in the context of healing and recovery, it is different in every possible way from what you have seen and maybe what you know to be true. There are very good reasons why we want to use hypnosis in the context of cancer treatment. Essentially, we're aiming for two main goals. The first one has to do with strengthening the body's defense system, which is our immune system. Strengthen our body's immune system so that it can do its job, which is to eliminate any abnormalities in the blood. So that is goal number one. The second goal is about helping patients become more resilient mentally, emotionally, and physically so that they can heal faster. So let's talk about immune enhancement, because when it comes to strengthening the functioning of our immune system, that means addressing the part of our mind we call the subconscious mind. That is where the deep-seated patterns that we know through research inhibit the ability of the immune system to do its job. That's where they reside. And these are patterns like stress, helplessness, and hopelessness, patterns that we are all familiar with. These patterns, according to a field of scientific study called psychoneuroimmunology, they disrupt our body's ability to defend against and recover from cancer. So it's absolutely necessary to address these patterns and resolve them if we want a fighting chance at winning over this illness. And again, I've done this for a very long time. I can tell you it has to be done. So that is goal number one. The second goal, important goal, I should say, that hypnotherapy can help us accomplish is, as I mentioned, to help patients become more resilient on every level, help them restore their sense of self, help them regain control over their experience, over side effects, and help them regain trust in their bodies, a relationship that has been altered when they received their diagnosis. Now, the subconscious mind is the part of our mind that governs many of our bodily functions. Let's talk about digestion, for example, body temperature, and yes, even immune function as well. And hypnotherapy, we want to use hypnosis and hypnotherapy because it's simply the key to the door of your subconscious mind. It's the key to the door of your subconscious mind. And it can make all the difference in the world when it comes to your ability and your body's ability to heal and recover. Hypnosis can help promote faster recovery rate. We have the research to prove that to be true. Hypnosis can offer you the much needed relief from the emotional turmoil and trauma from the PTSD, a relief that will not only be felt mentally and emotionally, but will be expressed in your biology in a meaningful and positive way, which means that, and that's the bottom line, that your odds for recovery will increase significantly. So if any of this resonates with you, if you want to leave no stone unturned, like many of my clients, you want to learn more, I will invite you to use the link below to set up a time for you and me to speak, a consultation, if you will, which is free and to the point. And it may be the very breakthrough that you've been looking for. Thank you for watching. I look forward to speaking with you and supporting you. Take care.